My name is Jay Ferguson with the Fascial Distortion model. We wanted to do some videos of our most frequently asked questions. So today's video is, what is the difference between fascial distortion model and other soft tissue techniques, specifically pin and stretch? So, what is pin and stretch? The Associated Bodywork and Massage Professionals, who have been serving the massage therapy community since 1987 through practice support, ethical standards, legislative advocacy, and public education. They define pin and stretch technique as the pin and stretch technique focuses the force of a stretch to a specific region of the muscle. The therapist uses their hand or other body part, such as an elbow or forearm, to manually place a pin into the belly of the muscle and then moves one of the muscle's attachments away from that pin point. The pin acts to stop the stretch force from spreading to the rest of the muscle beyond the pin point. Therefore, with the pin and stretch technique, the force of the stretch will be concentrated to the region of the muscle that is between the pin point and the attachment that is moved. So what's the difference between a technique and the fascial distortion model? Well, the word technique is just that. You're taught one method of treatment that's used throughout the body. With the fascial distortion model, it's a toolbox that brings all of those techniques you've learned under one diagnostic solution. You're taught to watch how your patient describes their discomfort using body language. You're able to classify that in one of 6 different ways that then leads you to choose the correct treatment, whether the treatments you're taught by us under fascial distortion model or other treatments you've learned to correct soft tissue discomfort. The beautiful thing is you can have full confidence, better outcomes, more efficient treatments, and just the ability to reproduce those outcomes from patient to patient just by trusting the model.
Hi, I'm Everett, and I'm the lead instructor for Fascial Distortion model. And we want to look at where the pin and stretch technique might fit into the Fascial Distortion model. And I want to start with a quote from Dr. Stephen Topaldos, who's the founder of FDM. And he wrote in his book, the Fascial Distortion model is an anatomical perspective in which the underlying etiology of virtually every musculoskeletal injury and many neurological and medical conditions is considered to be comprised of one or more of 6 pathological alterations of the body's connective tissues, including fascial bands, ligaments, tendons, retinacula, etc. One of those 6 fascial distortions that we're going to focus on is the cylinder distortion. The cylinder distortion typically presents with a distinct set of body languages and verbal descriptions that match it. Our patient example in this video shows them needing the area of concern. And that's very typical of a lot of people that are experiencing these cylinder distortions. Typically they'll describe these as a deep ache or soreness, and sometimes they might even have some difficulty telling you exactly where it is. And that's one of the key things behind cylinder distortions, is that sometimes they're unsure about exactly where that problem is. It's more of a generalized area, not super specific. So once you've properly identified that cylinder distortion, it can be corrected through any number of techniques that specifically address that distortion. And not all soft tissue techniques address every distortion. There are a couple of different techniques that we teach that are original to FDM, such as the squeegee, the double thumb, and the FDM burn, that are very effective at treating cylinder distortions. If you've been doing other types of soft tissue treatments in the past, such as instrument-assisted scraping or a pin and stretch technique, this is where those treatments shine. So with FDM, we don't ask you to throw out any of the material that you've learned previously in your soft tissue career. We want you to be able to add it so that you can do the most effective and efficient treatment for your patient. This is the beautiful thing about a model versus a technique structure. With a model, you're not biased or constrained to any one thing to fix everything that a patient comes in with. What patients come in with, what they show you, what they tell you are going to be very specific, and you can't use one single thing to fix everything that they might show up with. FDM providers are encouraged to be adaptable and to use any technique that helps increase their effectiveness and efficiency.
If you have any additional questions, please go to fascialdistortion.com. You can usually find the answers there, or you can call us or email us through the website. Thank you.